This video is for lab 5 topical medication administration. I'll do hand hygiene 4 times before and after touching the patient, before the procedure, and after touching patient surrounding. Hi there, I'm Pranika. I'm a student nurse. Can I get your name and date of birth, please? Okay, and I'm going to check that with patient's wristband as well as their chart. I'm going to check his level of consciousness, orientation, and I'll take his vitals. I'm also going to do priority assessment, which involves his integumentary system assessment. So the area where I'll be applying the topical ointment, I'm going to, it's on his right knee. Sorry, not knee. Right here. I'm just ankle. Or heel. Around his right heel. So I'm checking for things like if there's any sort of edema, lesions, or bruising, scratches, or if the pressure ulcer has gotten worse, which I don't see any of. And of course I would document these things if there is any abnormalities. Also, I'm going to check the area of his colostomy bag to see if there's any leakage around it or if there's burning around his skin of any kind. And I'm going to ask the patient if he has allergies of any kind. Do you have any allergies, Mr. Roger Stevenson? It shows here that you're allergic to codeine. Is there any other ones? No? Okay. Okay, I'm just going to be right back, Mr. Roger, and I'm just going to go prepare medication and I'll be right back. And before I leave, I'll of course make sure the side rails are up, call bell is within reach, and bed is closest to the ground floor for safety protocols. Okay, so next I'm going to verify the doctor's order here with MAR, which is the MAR right here. So I'm going to do my the 5 rights check. So it's for right patient, Roger Stevenson, right drug, so Xenoderm ointment, and on this one also Xenoderm ointment, right dose. It doesn't say dose, but it says 3 times a day. And over here it also says 3 times a day and gives the time breakdown. A right route, so it's ointment, which is through topical. And over here it also says it's ointment, so it's topical. A right time, 800 in the morning. Okay, so I've done my 5 check. Now I'm moving on to 5 rights, sorry. Oh, sorry, I'm going to do my 3 checks. I want to make sure also, sorry, that the doctor's order has been properly transcribed into the MAR, which it is. So I'm going to put the doctor's order away and now just refer back to the MAR, as the information on here has been correctly transcribed. So my first check, I'm going to pull the medication out of the drawer. I'm just going to pretend there's a medication drawer and I pull the medication out. And I'm going to now do the 3 checks. The first check, so right patient, and I'm also comparing it with my MAR at the same time, so it's hard for me to move my phone back and forth. So okay, so right patient, Roger Stevenson, right medication, my phone's so blurry, Xenoderm, and over here, Xenoderm, right route, topical, it says topical right there, and yeah, topical ointment, right dose, 3 times daily, right time 800, checks, and I'm going to check the expiration date, June 2022. Okay, and now I'm going to do the second check while holding it in my palm of my hand. So, and also at the same time still looking at the MR. So, right patient, Roger Stevenson, right medication, Xenoderm, right route, topical, right dose, 3 times daily, right time, 800, expiration date I already checked, right time, 800. And then the third check, after I've placed it on the tray, that's when I'll do my third check. So, right patient, Roger Stevenson, right medication, Xenoderm, right route, topical, right dose, 3 times daily, right time, 800. Okay, so I've gathered all my supplies here, so alcohol swab, tongue depressor, and gauze pad. And I'm going to go back to the patient's room again. 1 second. Okay, I'm going to enter the patient's room. Knock, knock. Hi, it's me again, Pranika, Sister Nurse. Can I get your name and date of birth one more time? And the patient confirms it accurately. Okay, so what I have here is some ointment for your ulcer treatment. So, right reason for the medication. So Xenoderm, the way it works is that it increases circulation, so there's more blood flow to the area where you have the pressure ulcer, and because there's more blood flow, it promotes healing quickly. So that's the reason. Some of the side effects, some of patient right education. So I'll be discussing some side effects. You might feel a little bit of stinging with this medication, which is temporary. Let me know if you have like any allergic reaction, like such as like you start developing any rash, hives, itchiness, or any blisters. And do you have any histories of any allergic reactions? No? Okay. And also please know that you have the right to refuse this medication. So knowing all this, are you okay with proceeding to take this medication? Patient says yes. Okay, I'm gonna go ahead and administer the medication now. So I'm going to apply clean gloves. Oh, sorry, do hand hygiene. Apply clean gloves. And if the patient's skin is not fully intact, then I'm going to need sterile gloves. I'm only going to expose the area of the skin where the medication will be applied, while keeping all the other areas covered. So, okay, taking my alcohol swab, I'm just going to position his legs like this, and I'm going to disinfect the area. I'm moving from inner to outward motion, about 5 centimeters. Okay, and I'm going to clean and dry the area, and then I'm going to change my gloves and do hand hygiene again. And now moving, using the tongue depressor, it's sterile. I'm going to get the medication and apply it evenly to the area. So I'm going to take a little bit of this and apply it to this area. And the reason why I'm using tongue depressor, it's to avoid contamination. And if I need to get a little bit more, then I'll go in with the other side and get more medication, so that way I'm not double dipping. Okay, so I've applied it to the area where the client has pressure ulcer. I don't want to put lotion on my teddy bear. So just to let you know, Mr. Stevenson, you might the area might feel greasy for a bit, just while it gets fully absorbed. And also, just because I don't want it to smear all over his clothes or like rub up against, I'm going to apply this gauze, and just to like hold the medication in place. And I might tape it to just hold it in place. Okay, so I'm going to lower the bed to the lowest position, both of the side rails up. Call bell is within reach. Okay, and all of my soiled linens or anything I'm going to dispose of and perform hand hygiene and clean up the area. So, right evaluation, I will come back in about 15 minutes to check up on the client. It's to check whether the medication has taken effect. I want to make sure that the patient isn't complaining about any stinging, and I'm not seeing any signs of like allergic reaction or any adverse effect, just to make sure that, so I would want to come back and check up on the patient for that. And also, how do I know that the medication was administered properly? So I followed the proper administration protocol based on the medication type, as according to that was listed on the MR, which was applied to the right heel 3 times a day. So I administered the 8 o'clock one, and also write documentation. So as soon as I administer medication, I want to sign the MR also. So I will sign under so because I administered the 8 o'clock one, I'll sign under the 7th. So I'll just put my initial there, PK. And I want to make sure that when I'm putting it into my charting also, I want to write down that the medication was administered at its right time and date, and I want to be signed right at the bedside. Medications also need to be administered within appropriate time frame, usually about 30 minutes. Otherwise, it will be considered a medication error. And yeah, that's about it for this one. Thanks for watching.